Hey guys, are you frustrated with all the mail and crazy TV commercials you're watching about Medicare health plans? Stick around, I'm going to walk you through the simple steps of how to choose the right Medicare health plan today. So here are the simplified ways to understand exactly what your options are and eliminating all the confusion. Step one, you need to know your Medicare options. One, understanding that Medicare is broken down into four parts: Part A, Part B, Part C, and Part D. And then you also have the ability to enroll into what's called a Medicare Supplement. And most people know these as 10 different plan options. In these plan options, typically most people choose a plan G or a plan N when it comes to clients that we deal with. So I'm going to break down the simplified version of what Medicare Part A, Part B, Part C, and Part D is of Medicare. So with Medicare Part A is always going to refer to hospitalization, and I always like to say Part A is in hospital, and then the other two services that most people experience with Part A services is skilled nursing and then hospice. Skilled nursing is the rehab portion of after a surgery at a skilled nursing facility. Hospice is if you're 6 months or prior to dying. However, they measure death by 6 months or prior, you would go into hospice. That's a Medicare certified hospice provider that provides Part A services for hospice. So Part A is hospital, inpatient, skilled nursing, and then hospice, and then a few other items. But those are the three main things that most people are most concerned about with Part A. So Part B of Medicare is the medical portion. This is anything outside of the hospital that's going to cover everything from like doctor visits, specialists, outpatient surgeries, diagnostics. Diagnostics would be like your MRIs or CAT scans or PET scans, PAT scans, CAT scans, all the different scans. And then it's going to also provide all the preventative services that Medicare, original Medicare, Medicare Advantage, and then your supplement would actually cover when it comes to like bone mass measurements, colorectal, prostate screenings, immunization, flu shots. Now it covers all the shingle vaccinations and COVID vaccinations. So Part B of Medicare is going to have a Part B deductible annually. This is year 2024, and it's a $240 Part B deductible now, and then you're going to pay 20% of the billable rate. Part A is going to have a deductible amount when you go into the hospital, and then it's going to have a cost per day amount that's broken down into skilled nursing. We have videos that talk about skilled nursing and exactly all the details of how that works. And then hospice is a service provided in and through Part A services at no additional cost and not a billable rate on Part A hospice. So that is Part A and Part B. Now let's dive into Medicare Part C. So Part C of Medicare, to understand the basics of that, this is all the Medicare Advantage plans or MAPDs or Medicare Advantage plans or Part C plans. Depends on how you've seen or read or saw a TV advertisement or whatever it may be advertised as. Sometimes people call them Part C plans as if they're new plans, but Medicare Advantage plans have been around since 2000. Early 2000s, 2006, they began to be referred to as Medicare Advantage prescription drug plans. So these are all the plans that are HMOs, PPOs, HMO, POS plans. There's all different types of Medicare Advantage plans. Typically, in a given area where there's a metro area, there's typically 6, 7, 8 different companies that will have Medicare Advantage plans. Those companies will have multiple plans, a lot of times up to 40 or 50 plan options in a given area around metro areas. Now, keep in mind, in rural areas, a lot of times there's less Medicare Advantage plan options, and there's network issues. So Medicare Advantage plans are driven by networks with HMO and PPO networks. And if you want to get more of a detail, we have videos and deep dives and things like that I'm going to talk to you about at the very end of this video. Now we're going to dive into Part D and exactly what does Part D of Medicare do. So Part D of Medicare is your prescription drug plan option or options, and Part D of Medicare is basically the ability for you to have a prescription drug plan that's Medicare approved that allows you to have lower cost share copay amounts. Now, up to 2024, there's always been 4 stages. Stage 1 is the deductible, initial coverage is stage 2, and then donut hole or coverage gap is stage 3, and then stage 4 is catastrophic. Now, coming in 2025, there's actually going to be 3 stages, and it's going to simplify everything down to a deductible, initial coverage, and then what they call the catastrophic stage, which is basically going to eliminate a lot of out-of-pocket costs. There's a lot of deep dives into teaching, and we talk about the Inflation Reduction Act. This is going to affect and change a lot of things with Part D coverage, but here's the main key with Medicare. If you're choosing to go into original Medicare, you want to pick up a prescription drug plan. You can either do that by enrolling into a Medicare Advantage plan that has a drug plan benefit, or you can do a standalone prescription drug plan if you're choosing to also enroll into a Medicare Supplement. Supplements are going to pick up everything except for maybe a deductible or a small copay amount that original Medicare does not cover. So your Part A deductibles, Part B deductibles are typically going to be billed by the supplement. The Part A is going to be covered 100%. The Part B deductible on like a Plan G or Plan N, you're going to pay out of pocket for that Part B deductible. But the 20% cost on original Medicare for Part B services is going to be covered 100%. So that is your Part A, Part B, Part C, and Part D of Medicare. We're going to dive into a little bit more about the basics. So make sure to really cut through the clutter of what you'll hear on TV advertisements, mail advertisements. Most of the things that you're being seen on TV and then coming in the mail is going to be marketing Medicare Advantage plans. Medicare Advantage plans, again, the HMOs or PPO plans are going to send mail to you. A lot of times there's confusion with that because you may be enrolled into a Medicare Advantage plan now or looking to enroll into a Medicare Advantage plan, and you'll actually get tons of marketing solicitations from the Medicare Advantage carrier that you're being insured by. Why they do that, I don't know, but make sure you simplify this to understand. If you're getting mail, seeing it on TV, or getting phone calls or texts, typically they're soliciting for Medicare Advantage plans. Now, legally, they're not supposed to be texting you, calling you, and making what we consider unsolicited marketing contact unless you have provided them the right to be able to call you. So if you go to our website right now and you click on a, contact me now, and a form pops up and you put your information in and submit that, it comes into our office, we're able to make contact with you. But if I just pick up the phone and randomly call you and say, hey, this is Bob Brown, I'm calling on behalf of this Medicare Advantage carrier, or marketing Medicare Advantage plans by phone, by text, or by email with the intent to solicit Medicare Advantage plan, it's a violation of Medicare rules, regulations. And so a lot of the TV advertisements, stuff that you're getting in the mail, it's just cut the clutter. Find somebody that's educated in the space and a licensed professional, and deal with somebody that knows what they're doing so they can educate you on these basics and what plan option is going to be the best fit for you. Step 2 is to evaluate your health needs. One of the things that most people sometimes forget about getting into the process of looking at Medicare health plan options, they forget about where their health is. And some people aging into Medicare are extremely healthy. Sometimes you're dealing with a chronic illness, maybe a disease, maybe something over the last 15, 20 years. You need to really evaluate your health needs and allow that to connect with the type of health plan that you best want. If you're going into another area, let's say you have a chronic disease and you have to travel into another state to have treatment at like the Mayo Clinic, you may want to ensure that you're enrolling into original Medicare and choosing a Medicare Supplement because they don't have networks. This is very important when evaluating health needs, because often, a lot of times, people are choosing based on their emotions that are driven by TV advertisements again, or mail, and then you're talking to somebody and they really kind of paint the sky blue with Medicare Advantage and push Medicare Advantage, when sometimes we do have a population of people that do not need to be enrolled into Medicare Advantage plans. And we do a ton of enrollments in Medicare Advantage plans. We have a lot of clients that love the plans. We do the proper job, and if an agent's doing the proper job and evaluating, they're going to look at your health needs and help match you to a plan that meets your health needs and your access to care. And reminder, always look for something that's going to cover your primary care doctor, your specialist, your medications, and allow you to have access to the things that you need and require for maintaining and improving the quality of your health. So if you are looking at Medicare Part C, Medicare Advantage plans, HMOs, PPOs, and the other Medicare Advantage plan options, keep in mind these are network driven. You do want to look at the network in the plan that you're enrolling into. So if you're enrolling into a HMO, in metro areas, a lot of times HMOs have extremely large networks. Usually their cost share and copays and things like that are going to be less. You want to still make sure that you're looking and having somebody look up the primary care doctor, the specialist, the hospitals. Your access of care in and through the plan is vital for you. And then keep in mind, years ago, companies would come out of network with a healthcare plan, a Medicare Advantage plan. They have a contract, and this is how this works. So legally, they have a binding contract that says this doctor, this hospital is in contract with this Medicare Advantage carrier. And typically they would break those contracts in the middle of the year, and they would create disruption for the Medicare beneficiary. Well, the health plan, the Medicare Advantage plans, began to have a little bit of wisdom and realize that would be upsetting. To you, it'd be upsetting for me, it'd be upsetting for anybody experiencing that. So what did they do? So what they did was they simplified this down, and typically they're gonna come out of contract towards the end of the year. So during the annual enrollment period, if you're enrolled into a Medicare Advantage plan and you've been notified that your plan is coming out of network with your doctor, again, you would get with a licensed professional. They're going to guide you through what Medicare Advantage plans that doctor takes, your specialist takes, the hospital takes. It's just key to remember that sometimes there is a disruption in the network. Most of the time it happens towards the end of the year. You can enroll into a new plan and then have coverage at the beginning of the start of the upcoming year, and there's not really any lapse in coverage issues. We don't see a lot of times doctors coming out or hospitals coming out in the middle of the year to create disruption because the health plans want to do what's right, and it relates to the star ratings, which we're going to be talking about in another video based on the 5-star rating of Medicare Advantage or Part C plans. Step 4 is considering the cost beyond the premium. A lot of times people are looking at Medicare Advantage or Part C plans based on the premium only. And typically in our general area, around the Middle Tennessee, around the Nashville market, most Medicare Advantage plans that are great plans are 0 premium. So people look and go, hey, I'm not going to pay anything, so I'm just going to enroll in this plan. It's going to be great. But you also need to consider, what are the copay? What's the copay for access to your primary care doctor? Most are 0, very small. But what is the copay for my specialist? Typically, it's no more than $50. A lot of times, no more than $25 or $30 on most plans. But you need to know these details. How do you access your care? What is the most relevant thing that you access when it comes to primary care, specialist, hospital, and then medication? What is my medication cost going to be when it comes to the copay? What am I going to be obligated to? And then understanding that 0 doesn't always mean that I'm not going to have any additional costs. The other important factor that you need to understand with Medicare Part C or Medicare Advantage plans, and if you understand this, the plans work great, is they all have a max out of pocket. So that's governed by the government. Most plans range from about $300 to $5,500 in most markets that have great Medicare Advantage plans, but you need to know that my risk is up to that amount. Typically the average, national average copay cost that most people spend on a Medicare Advantage plan is about $750. So for medical hospitalization needs, you're not going to have a lot of money out of pocket if you're not using it a lot, but if you had a catastrophic year, you're going to have higher cost, and we would encourage you to ensure that risk in using an ancillary product that would cover the copay costs for your hospital and cancer. Those are the two major issues that most people have high out-of-pocket costs based on Medicare Advantage. So the last step, make sure you have a professional helping you and guiding you through the different plan options, making comparisons. You may be enrolled into a plan right now. You may be enrolling or becoming new and eligible to Medicare. It doesn't really matter. You need to have a licensed professional that has a history of experience. Dealing with somebody that's brand new in the industry, sometimes they're confused, you're confused, and it creates more confusion and it's frustrating. Find somebody that's been licensed, that has done a lot of business in the Medicare space, that understands Medicare Advantage, Medicare Supplements, prescription drug plans, the different health plan options, dental, hearing, and vision, all the different things about Medicare that's important to you and that you connect with personally, that you want to build a relationship with long term. You may have a financial advisor that you've been using for years and you have a relationship there. It's important as you age into Medicare to build a relationship that matters with somebody that's an expert in the Medicare space, that understands all the different plan options as we just talked about in step 1, understanding all the Part A, Part B, Part C, Part D. Medicare Advantage would be Part C, then Medicare Supplements. They do everything so that it encompasses all your needs. In case your plan needs change, you need to have somebody that knows what they're doing. Hey, making a selection doesn't have to be overwhelming and confusing. We often say Medicare is extremely confusing. We're here to make your life easy by making Medicare simple. Guys, if you need some additional help and support, if you click below, there's actually going to be the ability for you to register for one of our workshops, either an on-demand or live Medicare Made Simple workshop, or just click below, schedule a time for us to be able to talk, and we can actually walk you through and do the review over your Part A, Part B, Part C, Part D, or Medicare Supplement plan options. Click below now. We'll talk to you soon.